Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi, and the channel is My Take on It with Dr. Victor Obasuyi. Today, I'm going to be talking about the risk factors for diabetes and some of the things that makes it worse. Diabetes is one of the leading cause of blindness in people, and most of the problems can be avoided. But ignorance, I notice, is one of the major reasons why a lot of people lose their sight to diabetes. So today, I decided I was going to talk about the risk factors. So there are factors that we can control, and there are some that we can't control. The main ones that we cannot control are the ones I'm going to start with. First and foremost, your race. Indians or Asians, if you're being black, Hispanics are very highly prone to diabetes. Then, genetics. If your parents are diabetics, chances are very high that you also be diabetic. And the risk is higher if both parents are diabetic. Then age. For a lot of us, once you're 40 and above, the chances are higher, especially if you have if you live a very careless lifestyle, and I'm going to come to that. For a lot of people, what they don't understand is diabetes can easily be managed. It's one of those things that it won't bother the eyes if you don't bother it. I've seen patients that have lived with diabetes, patients that have had diabetes for 20-something years, and their vision, the back of the eye is still very good. But I've also seen patients that 5 years, 6 years of being diabetic, because their blood sugar level is always on the very high side, they start to develop bleeding at the back of the eye, which is the retina. Once you start developing bleeding signs at the back of the eye, chances are you're going to be needing laser to seal those broken blood vessels. The more laser procedures you've done, the higher the chances, if you're not careful, that you go back for more, and you could easily lose your vision. So those are the race or your ethnic background is a major factor. Then your lifestyle, genetics, age, like I said. Then the ones that we can control, which I find a lot of people take for granted, are things like being overweight, obese. Most people think you have to be extremely fat. You have to be very, very fat to be considered obese. That is not the truth. Science considers you obese if your waist to hip ratio is more than 1.1. Your waist, you can take a tape, get a tape, measure around your navel, round. Measure the circumference, then measure the circumference of your hips, which is where you put your belt. If the number for your waist is higher than your hip by 1.1, then you're considered obese. The problem with that is most times fat is stored in the abdomen, that area. Once that ratio is more than 1.1, it means you have to be very careful. Then, people that drink a lot of alcohol. If you consume a lot of alcohol, alcohol will also lead to insulin resistance. Your sugar level will go up. For people that smoke, same problem. So these are things that we can easily control, especially if you're already diabetic or you're pre-diabetic or you have a history of those predisposing factors in you. Then, people that don't exercise. Again, when you exercise, you know you burn a lot of calories, which means your insulin will be able to work more for you. But just like alcohol gives you a lot of calories. That is why your insulin becomes resistant. The same way, if you don't exercise, all the calories you consume are all stored in you. Then, again, you also run into the same problem of your sugar level being too high. Then there are also people that don't move around out in the sun. Vitamin D does not only help in cases of infections, it also helps with insulin use. So if you know you're prone to diabetes, spend a lot of time outside in the sun. Get a lot of vitamin D. Vitamin D, it will help reduce your sugar level. Basic things like this are things that I think we can easily do, but a lot of people take it for granted. Especially if you've been diagnosed with diabetes, exercise, 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 exercise. A lot of it will help. What you consume. People consume a lot of white food, grains, carbohydrates. A lot of times people find diabetes tend to be more common among the poor. And why? Because the starchy foods are the cheaper ones. Those are the foods that they can afford. Again, lack of awareness. You consume all those starchy food and you don't burn them off. Of course, you're going to be diabetic. People will tell you, oh, my father ate this food, my mother ate this food, they're not diabetic. But most of those, your parents they're talking about back home, most of them were farmers. They go to the farm, they spend a lot of time in the sun, and they spend the time tilling the soil. What do you think is happening? They're burning all those calories. It's different if compared to you that consume the same food and sit at home to watch TV. So these are things I just thought basic things that we should know. Smoking is a no-no. Lack of exercise, no-no. Not going out in the sun, no-no. The food you eat, whole grains will help a lot. Veggies, instead of consuming all the starchy food. It will help. Just these basic tips, if you can control them, then your chances of your sugar level hitting the roof is very slim. Then stress. People stress themselves over what will happen in the next 10 years. 10 years, you have to be alive in 10 years to confront that problem anyway. Right? I believe stressing yourself over what's going to happen next month is of no benefit to you, especially if you cannot change the situation. If you're diabetic and you keep you panicking over what's going to happen 5 years from now, what's going to happen one year from now, take it one step at a time. You have to be alive to confront that problem that you envisaging in 1 month or 6 months, 1 year from now. Stress again will shoot your sugar level up the roof. So if we can take these little precautions, I'm very sure, apart from the fact that you'll be able to control your blood sugar more, then the impact of diabetes on the eye will also reduce. A lot of patients don't bother checking their sugar level. When I ask them at the clinic, how often do you check your sugar level? I check it like maybe once. I've not checked it in a very long time. True. The patients that I find that check their sugar level more often tend to be more able to manage their blood sugar level. Sometimes they're also the ones that also take their medications as prescribed. People that are very careless most times are the ones that end up with diabetic retinopathy, which is blindness due to diabetes. So I just thought I'll let you guys know. These are basic things that we should all know, especially if you're getting close to 40 and if you're black, Hispanic, Asian, Indian, like I said, those are the major ethnic groups that are most likely susceptible to diabetes. So, and again, if you have a family history of it, then all these things I'm telling you are precautions that you should take if you're highly prone to diabetes, or if you're pre-diabetic, or if you're already diabetic. So I just thought I'll share these tips with you guys. And Next time I'm going to talk more about how to manage the condition itself. Diabetes is a condition where the blood sugar level is usually a lot higher than normal, and the three things that you find that you start losing weight. The three P's: polydipsia, polyuria, and polyphagia, which means you eat a lot. You find yourself consuming a lot of food, you drink a lot of water, and you find yourself urinating often. When you find those three things, and a lot of times your vision will be fluctuating, because when the sugar level is going up and down, your vision will also fluctuate. Those are the things that you will know immediately that, okay, something might be wrong. Go and get checked. Thank you, ladies and gentlemen. Next time I'll dive more into how to manage diabetes and the eyes. Other than that, if you think you learned one or two things from the video, please kindly share it. You may know, other people might not. Thank you. I'll see you at the next video.